Good afternoon. I'm glad you're all here. It's kind of late, isn't it? So as Marina said, let me put this up here. You saw that we found some effects around employment on desistance and onset of alcohol problems in young adulthood. And so my analysis looked more closely at how the alcohol environment at work might be contributing to high-risk drinking in young adulthood in Australia and the United States in the sample, and whether there were, in fact, differences. Hold on. There. So you probably all know that the drinking prevalence, particularly also heavy or high-risk drinking, is highest in young adulthood when alcohol becomes legal, so some of that makes sense. And we know that high risk or heavy drinking has, of course, negative consequences like drinking, driving, and injuries, and accidents, and so forth. So preventing high risk drinking in young adulthood is an important public health goal. But we haven't really focused much on young adulthood as an intervention or prevention period. It's been underutilized so far. The kinds of evidence-based programs that do exist for alcohol use have been focusing on college students. But only about half of all young adults are in college. So really, one other place we could be looking is the workplace. The workplace could be an important context to reach young adults, especially those who are not in college, but even college students, most of them work as well. And you might not be surprised to hear that the prevalence of drinking or being impaired at work is also highest among young workers compared to older workers. And this is in part also due to the fact that younger workers are more likely to be in high-risk industries, such as the restaurant or bars or sales and so forth. And obviously, preventing workplace alcohol use is also an important public health issue because drinking at work also has negative consequences, including increased risk of injury and accidents, absenteeism, and also problems at work. So let's look at what the prevalence of alcohol use at the workplace looks like. It's in fact pretty difficult to find data on this, particularly for young adults specifically, but luckily in our international study, we asked about these kinds of things. So here I'm showing you the age 25 data from the IYDS sample that was collected in 2014. And we asked several questions about workplace alcohol use and impairment. First, keep pressing the wrong button. We see that 14% of the young adults in the Washington sample said that they drank at work during work hours, like for example during lunch in the past year, compared to 26% in Victoria. And you might not be surprised, given what you've seen already in terms of the differences, that this is higher in Victoria. You also see that the prevalence of drinking after work, but at work, in the workplace, is also much more prevalent in Victoria compared to Washington. We also asked whether they worked while being under the influence of alcohol, and you see there's not much of a difference, and also whether they came to work with a hangover, which you see is the most prevalent behavior in this set of questions. And in all cases, these behaviors are more prevalent in Victoria compared to Washington. And when we look at any of these four behaviors, if they've engaged in them in the past year, this is not. We see, again, overall this difference, and you can see more than half of young adults in Victoria were impaired at work or used alcohol at work. And you've seen some of these data already before as well. I just wanted to put them up again, that also, in addition to alcohol use at work, employed young adults in both samples, you see the same differences, that young adults in Victoria are more likely to drink any alcohol in the past 30 days, but also that there's higher levels of binge drinking and risky, harmful, or high-risk drinking based on the alcohol use disorder identification test criteria. So you already saw this. And one question is, well, is on the job and off the job or general drinking, is that associated with each other? And we would expect that it is. And what we see in the sample is that risky drinkers, either in terms of risky, harmful, high-risk drinking, according to the audit, or binge drinkers, are extremely likely to use alcohol at work or be impaired at work. So in both samples, you see that 88% of risky drinkers who are in general off the job are drinking on the job, and binge drinkers as well have a really high likelihood of using alcohol, being impaired at work. So there's a strong association between on the job and off the job drinking. So what do we know about risk factors for workplace drinking? We, in fact, know there are various variables, and in particular, I'm focusing on the three that you see here. We do know that if alcohol is available at work, if there's no clear written alcohol policy, and if alcohol use norms at work are more permissive, then there's a higher risk of on-the-job drinking, and we're expecting, because the strong correlation between on-the-job and off-the-job drinking, that there's also a spillover effect on drinking in general. So we know this is the case. But given, as you heard, the different alcohol policy contexts in both countries, our question really was, well, does that differ? Does both the impact of the alcohol environment at work have a different impact on alcohol use on and off the job? And is there a different level of, or is the workplace alcohol environment different? So we had two primary research questions for this analysis. So we know that alcohol use is higher, the prevalence is higher in Australia, and one of the reasons for this might be, as we saw in part by Marina's presentation, that the workplace alcohol environment is more tolerant in Australia compared to the US, given the larger context in terms of the alcohol policy setting. But it might also be that the relationship between the alcohol work environment and alcohol use is different in both countries. In particular, we hypothesized that a more permissive workplace alcohol environment might have a stronger impact on alcohol use in the United States, where there's more of a no tolerance context. So we assessed these questions with the IYDS data, with looking at the age 25 data collection that was collected in 2014. And for this analysis, I focused only on young adults who were either currently working or had been employed in the past year. And you can see about 90% in both countries, in both samples, were employed. So here I'm showing you the differences in the workplace environment. First, in terms of the availability of alcohol at work and whether a policy exists. And as expected, as we hypothesized, young adults in Victoria are much more likely to say that alcohol was available at work. You can see almost more than twice as likely to say so. But they were less likely to say that there's in fact a written alcohol policy at work. And at the same time, which is also consistent, they're also more likely in Australia to say that they actually don't know if there's a workplace alcohol policy. It's also important to look at the content of the policy. A policy that completely bans alcohol has a stronger effect usually than one that might only say that you must not be under the influence of alcohol at work, but alcohol is not completely banned. So we asked about that as well, and not surprisingly, we see that that young adults in Washington say that they're more likely to say that the policy says that alcohol is completely banned in at work, and then young adults in Victoria are more likely to say, well, it's you must not be under the influence, but alcohol is not completely banned. And as we already saw in Australia, young adults are less likely to actually know what the content is or whether a policy in fact exists. The other piece to the alcohol policy is the question whether it's in fact being enforced. So we asked how likely it would be that their supervisor would take disciplinary action in several different situations. If an employee violated company drinking policy, if they saw an employee drinking on the job, or if an employee was unable to do their job because of drinking. And what we see, again, I'll put them up all at the same time, again, you see that in Washington, young adults are more likely to say that their supervisor was very likely to take disciplinary action in all of these situations, and these all are significantly different except for the last scenario. So far this is all consistent with what we would expect. Finally, the normative aspect. We looked at both behavioral norms as well as attitudes. And the first question we asked is whether coworkers drink at work or come to work drunk or under the influence of alcohol. And you can see that young adults in Victoria are more likely to say that their coworkers use alcohol at work. And this is significant. And then we also asked what the attitude at work is towards being under the influence of alcohol at work. And you can see that in Victoria, it's more likely that the attitude is to tolerate or maybe even encourage alcohol use in the workplace, or maybe discourage it but not be totally against it. So all of this is consistent with what we would have expected, that overall, the workplace alcohol environment is more tolerant in Australia in all of these 3 risk factor sets. So let's turn to the second question in terms of whether the relationship between these workplace risk factors and alcohol use is different in the 2 countries. To look at that, we used logistic regression, and we both looked at 2 different variables, both on-the-job drinking and then risky or harmful drinking in general. And we used each of these workplace alcohol environment factors that I just showed you as a predictor in separate analyses, and used an interaction to model the difference in the relationship. And we adjusted for, like in the analysis that Marina presented, for gender, whether the young adult was white or non-white. And then we also controlled for alcohol use in adolescence, because we wanted to make sure that whatever we're seeing is actually the workplace environment that's making the difference, and it's not because young adults who were already early drinkers are more likely to drink now. And when we predicted on-the-job drinking, because we saw there's such a strong association between on-the-job and off-the-job drinking, we also controlled for current risky or harmful drinking to make sure we actually understand whether it's the workplace that's driving this relationship, and not only because risky drinkers are also more likely to drink at work. And so what I'm showing you here, first, the results with respect to predicting drinking at work, and these are odds ratios. So I'm showing you the odds of drinking at work if alcohol was available at work. And you can see in both countries, this is an extremely strong risk factor for drinking at work. With respect to policy, and we had different ways of looking at this, whether there was a policy or not, whether alcohol was completely banned or whether there was disciplinary action or not, all of these policy-related factors are strong risk factors for drinking at work in both countries. And then finally, with respect to norms, we also see that in both countries, all of these factors, coworkers drinking and attitudes towards alcohol use at work, are strong risk factors for drinking at work. Not surprisingly, we already know this, but it's important to understand that this is the case in both countries with these different alcohol policies. We do see, however, that some of these normative factors have a stronger impact on drinking at work in Washington compared to Victoria, and this is what we would have predicted given the larger policy context. So then the question is, well, do these workplace factors are they also associated with risky drinking in general? And so that we looked at it in the same way. And you can see if alcohol is available at work, young adults in both countries were more likely to also engage in risky or harmful drinking in general. When we looked at the policy, you can see whether there's a workplace alcohol policy makes a difference also for risky or harmful drinking in general in Washington, but not so much in Australia. And then with respect to norms, we see for most of them that norms do, again, also predict risky or harmful drinking in general, not only on the job in both countries. There were only a couple of differences. The availability of alcohol and a policy-related factor were, again, more impactful in Washington compared to Australia. So again, consistent with what we had expected. So our second hypothesis about the relationship between the workplace alcohol environment and alcohol use was only partially supported, because overall we saw that a more permissive workplace alcohol environment was a strong risk factor in both countries for on-the-job drinking. We did see that alcohol use norms, if they were more permissive, they had a stronger impact in the US. That was the only difference, but consistent with what we had predicted. But we also saw that in both countries, the workplace alcohol environment also predicted off-the-job drinking or drinking in general. And the only thing that we saw was that whether there was a policy or not didn't matter as much in Australia, and the alcohol availability had a stronger impact on off-the-job drinking in the United States. So what does this all mean? What are the prevention implications of this? I think it's clear that the workplace could be a critical context for alcohol misuse prevention and intervention in young adulthood. And as I earlier argued, I think in part because it would reach young adults who are not in college and also young adults who are in these high-risk industries. And I think the fact that we found that these workplace factors that we see that there are strong risk factors in both countries suggests that these are targets in any kind of, in both policy contexts, and all three do matter in both countries. Unfortunately, there are few evidence-based workplace interventions for young adults at this point. What we do know in general about workplace intervention is that if it's a prevention approach that is integrated within a health promotion framework, that works best. And there are a few promising workplace interventions specifically for young adults that have been tested with, for example, restaurant workers or young adults who are in supermarkets or the railroad industries, like team awareness and team resilience. But at this point, the evidence base is not really there to say that these are evidence-based programs. So our task now is to engage in more rigorous testing of these already promising approaches and potentially also develop additional workplace interventions that could make a difference. So thank you.